Hello, my name is Jody Holm, and I work for the North Dakota Department of Human Services in our state Medicaid office. I am the administrator of the health tracks and the children's health insurance programs for the state of North Dakota. Today, we are going to be discussing Medicaid and health tracks for children in North Dakota, and I'm going to discuss understanding EPSDT. What is EPSDT? EPSDT is the Early and Periodic Screening, Diagnosis, and Treatment Program. This is a federally mandated healthcare benefit package administered in partnership with all states and territories, and it is essential for all Medicaid enrolled children ages birth through 20 years of age. The goal of EPSDT is the early detection, prevention, and treatment of all problems in children and youth enrolled in Medicaid. Who is eligible for EPSDT? Any child who is Medicaid enrolled is eligible for EPSDT benefits up until their 21st birthday. Is EPSDT different from Medicaid? It is different from Medicaid. Through EPSDT, each state's Medicaid plan must provide to any Medicaid recipient or EPSDT recipient any medically necessary healthcare service, even if that service is not available under the state's plan to the rest of the Medicaid population. There are certain items that are not covered under EPSDT, such as experimental treatments, services or items generally not accepted as effective, and services for the caregiver's convenience. These are services that must be directly for the child. Why is EPSDT important? More than half of all Medicaid enrollees across the country are children. EPSDT is designed to enhance primary care of children with emphasis on prevention, early diagnosis, and timely treatment. Now let's talk about some Medicaid mandatory and optional services. As you can see in the first column, these are all the federally mandated mandatory services: inpatient, outpatient hospital, lab, x-ray, EPSDT, family planning, etc. In the middle column and the last column, you will see that those are optional services that a state can choose to cover in their Medicaid benefit. The one thing that is unique about EPSDT is all optional services have to be available to children under the age of 21 if they're found to be medically necessary. What is medically necessary? Medically necessary is defined as a covered service or item if it will do or is reasonably expected to do one or more of the following: to arrive at a correct medical diagnosis, to prevent the onset of an illness, condition, or injury or disability in the individual, reduce, correct, or ameliorate the physical, mental, developmental, or behavioral effects of an illness, condition, injury, or disability. Basically, what this means is that you need to maintain that child at a certain level, or it to assist the individual to achieve or maintain sufficient functional capacity to perform age appropriate or developmentally appropriate daily activities. EPSDT implies the importance of early periodic screening diagnosis in children. There are benefits in EPSDT that are not provided for in regular Medicaid. The most obvious is the health tracks or periodic screen. So, what is a health tracks screen? Health tracks screenings are the foundation of the health tracks program. Health tracks requires Medicaid providers to assess a child's health needs through initial and periodic examinations and to assure that any health problems found are diagnosed and treated early before they become more complex and their treatment more costly. Medicaid enrolled children receive both comprehensive well child exams or periodic screenings and any necessary visits in between, known as interperiodic visits. The health track screen is a comprehensive checkup. It is not necessarily a well child checkup because the doctor can do a comprehensive checkup sometimes when a child is ill. However, a comprehensive checkup is usually done at the time a well child checkup is scheduled. In order for a comprehensive checkup to be counted as a health tracks periodic screening, the checkup must include all of the components outlined for in health tracks screenings. Some of these components include mental health, hearing, dental, developmental, laboratory screenings, etc. If only some components are included, it should be considered an interperiodic screen. The first step for health track screenings are completed by the PCP or the primary care provider or your local public health unit in North Dakota. Screenings should be provided at intervals established by the state medical consultant. North Dakota uses the Bright Futures curriculum. This was designed by the American Academy of Pediatrics. North Dakota's periodicity schedule is 3 to 5 days after birth, by 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, 30 months, and then annually up through age 20. It's also important to note that a child should be seen by a dentist starting at first tooth eruption or by 1 year of age or earlier if a problem exists. Some components of the health track screening include a developmental assessment, a health history, an unclothed head to toe physical exam, identification of all medical conditions and needs, immunizations according to the Advisory Committee on Immunization Practices, age appropriate lab tests, health education, including anticipatory guidance for not only the parents, but also for the children, a nutritional assessment, mental and behavioral health screening, a vision screening, a hearing screening, oral inspection, and then treatment and referrals for any necessary services. There's particular emphasis on certain items at certain ages. Again, the immunizations are in accordance with the ACIP schedule. Laboratory tests for lead toxicity at 1 and 2 years old or any time up to age 6 if not previously tested. Mental and behavioral health screening and coordination, vision services, hearing services, dental services, and health education. Interperiodic visits. Interperiodic visits is any care that occurs outside the periodic screening schedule, including partial screenings. This may include an exam for a child who is experiencing maybe an earache or a child who maybe had a partial screening at school and there was concerns noted and they were referred to their local public health unit or their primary care provider for further testing. Earlier, we had talked about Bright Futures and the Bright Futures curriculum. Here is an example of a pre-visit questionnaire that would be done at 2 months of age that is filled out by the caregiver prior to them coming into the screening. This is an example of what the Bright Futures Well Child 1 month visit, the top portion of the um, examination form would look like. Bright Futures also includes several handouts that will go to the parent. This is an example of a parent handout at 2 months of age. These would be things to look for to make sure that your baby is growing. And then also, how are you as the parent feeling? Do you need further care? Have you been to see your doctor? How is the feeding going? Is your baby eating enough? Are they growing? And then how is your family doing? If this isn't your first child, how are the other children in the family adjusting? There's also a mental health screening tools that are used at the health track screenings. These are done at age 0 through 60 months. So we have the ages and stages questionnaires. It's the social emotional, the Bergantz 2, and also the brief infant and toddler social and emotional assessment, also known as the BITSI. Here you can see an example of what the ages and stages questionnaire would look like. It's a series of questions that is asked to the caregiver at the time, and it is then scored by the individual that is doing the screening. Okay, now let's talk about the mental health screening tools that are used for our older children. These are for children ages 5 through 21 years of age. There's the Pediatric Symptom Checklist, also known as the PSC. There's the Pediatric Symptom Checklist Youth Report, or the YPSC. And there's also a Strengths and Difficulties questionnaire that's used called the SDQ. Here is an example of the Pediatric Symptom Checklist. It's a series of 17 questions, and you can mark on them 0 for never, 1 for sometimes, or 2 for often. Um, this is either done by the child themselves, depending on the age of the child, or it will be done by the parent and then scored by the individual who is giving the screening. Here's the example of the pediatric symptom checklist, very similar to the other one. Just goes down again. You'll see they score it from 0 to 2. For 0 is never, 1 is sometimes, or 2 is often. Again, this can be filled out either by the child or by the parent. And then here is just an example of the strengths and difficulties questionnaire. Very similar. It's just a series of questions and you go down and put check marks down. Some other screenings that are used, we use the MCHAT for autism, the CRAFT for the substance abuse and alcohol abuse screening. We use a patient health questionnaire modified for teens. And then we also use the Kuchar Adolescent Depression Scale. Here is an example of the MCHAT. This was revised. That's why there is the R On there, it's just a series of yes or no questions that's answered by the parent. And then you have the craft, which stands for car, relax, alone, forget, friends, or trouble. And again, this is just a series of questions that is answered either by the patient or the child. Typically, this one's used in older children, so it's usually um, done by the child and then scored by the screener. Here's an example of the Patient Health Questionnaire 9 that's been modified for teens. And again, you can see it's done on a scale of 0 to 3 and would be rated again by the screener. And then here again is the Kuchar Adolescent Depression Scale. It's 11 questions. I was not able to fit them all on the screen, but this is just an example of what kind of screening tools we use. Over the years, we do different trainings for our providers. This location here, this was a children's mental health training that was done. In what's included in this is just different screening tools and how nurses and social workers can screen these children. Some other screening tools that we use, we do maternal depression screenings. So they can be done using one of the three tools. The first one is the Edinburgh Postnatal Depression Scale. The second one is the Patient Health Questionnaire, or the last one again is the PHQ-9. Maternal depression screenings are for moms that have given birth within the last year. Uh, we ask that the screening providers screen mom at least 3 times within the first year of the child's life to look for any signs of maternal depression. And if there's any signs of the depression, we ask that they refer. Screening results. If the screening is normal, the primary care provider or public health unit should assist the family in scheduling the next health track screening. Again, they would do that based on the screening schedule that we had talked about earlier. And they should also ensure that biannual dental exams occur every 6 months for the child. And again, this is if the screening is normal and there's no referrals necessary. If the screening is abnormal, there's a few things that need to happen. Depending on who did the screening, if it was done at a local public health, they'll probably want to refer to the child's primary care provider for further evaluation. They'll then, from there, the primary care provider would want to develop a treatment plan and provide treatment if appropriate, refer to a provider for further evaluation or treatment if necessary. For example, if there is noted loss of hearing, they would want to refer to an audiologist, for example. They'd also want to assist the family in scheduling their next health track screening. Even though they're trying to move them on and trying to get them referred for diagnosis and treatment, it is still also important to remember that they come in and schedule their next visit. And it's also important for them to ensure that the biannual dental exam occurs at age 1 year and then 6 months after that. There are some service limits with North Dakota Medicaid that we have to be aware of. So, for example, chiropractic manipulation visits are 12 per year. X-rays for chiropractors are allowed twice per year. A psychological evaluation is one per year. The psychological therapy visits are 40 per year. And then psychological testing is 10 units or hours per year. And then vision testing and prescriptions for glasses under 21 years of age is one exam and one set of glasses per year. And then occupational therapy, physical therapy, and speech therapy no longer have limits for Medicaid eligible children, meaning that no matter how many visits they have, those will all be covered by North Dakota Medicaid as long as they are medically necessary and the providers do not need to get a prior authorization from our office to have those visits. Okay, how is North Dakota doing? So the federal goal for screening for children in Medicaid is 80%. In 2019, federal fiscal year 2019, 69% of all Medicaid eligible children in the state of North Dakota had a screening of some sort. In 2018, we were at about 70%. So it seems like we are doing fairly well, but we still have more children to reach. Okay. Attached is my contact information. Again, my name is Jody Holm. I am the health administrator of the Health Tracks program. And attached, you will see my phone number and my email address. If you have any questions at any time, please feel free to reach out to me, and I would be more than happy to visit with you on anything. Thank you very much for inviting me to participate in this conference. I hope that you enjoy the information and found it useful. And again, at any time, if you need to reach out to me, please don't hesitate to do so. I'm more than happy to answer any questions that you may have. Thank you and have a great day.